Hi, I'm Dr. Gauthami Nagabhirava. I'm a psychiatrist, and today I'd like to talk about mental health and misconceptions. So, how do we decide if a patient has a mental illness or not? Any deviation from normal, behavior that is extremely overdone or underdone, is considered abnormal. A person is considered to have a psychological problem or illness when they have abnormal thoughts, emotions, behavior, or relationships. Most importantly, when these psychological problems lead to disruption in a person's day-to-day functioning or cause distress to them or someone around them, we say they have a mental illness. Now I'd like to go ahead and talk about some commonly held misconceptions that often hinder treatment and prolong suffering. Is mental illness rare? No, it's not. 450 million people suffer from mental illness. India is the most depressed country in the world. 1 in 5 Indians are likely to suffer from mental illness at some point in their life. Another misconception is that these illnesses occur only to those who have a bad character or are weak. Many patients will come to us and say, it's ridiculous. I should be able to control my own thoughts. Maybe I'm just weak. But just like a person with diabetes can be physically strong, a person with depression can also be mentally strong. These illnesses occur due to changes in your brain chemistry or brain function. It's not your fault. Everybody is vulnerable to mental illness. Nobody is immune, not even children and the elderly. Another misconception is that these illnesses occur only to those who have a bad past, for example, bad parenting or trauma or abuse, but that's not necessary. These illnesses occur due to what we call the biopsychosocial factors. So what that means is your biologically, your genetics, psychologically, your personality, your attitude, your beliefs, and your social circumstances. All three interact to cause a mental illness. Nowadays, however, we see many patients who come to us and who tend to write off their symptoms by saying, it's just stress, I'm going through something. But stress rarely alone will cause a mental illness. If I take somebody to a sweet shop and feed them 10 sweets, they're not going to get diabetes. You must have that genetic potential or that genetic vulnerability. So it's not the stressor itself, but how you react to a stress that matters. You also cannot treat mental illness through self-control or discipline. Just like you can't reduce your fever through willpower or reduce blood pressure by willing it away, the same equation applies to mental illnesses. Yes, you can engage in yoga and meditation to promote positive mental health, just like we use lifestyle modifications for physical illnesses. However, since these are legitimate medical illnesses, you may require medication. Now, medication is not always dangerous or addictive, like people assume. We have safe and effective medication and evolved methods of therapy. Psychiatrists will not always force medication on you. Another misconception is that once a psychiatric patient, always a psychiatric patient. But that's not true. These illnesses are treatable. Early identification, adequate and timely intervention means that recovery is possible. And even for those patients who have serious mental illnesses, with medication, these individuals can lead a productive life. Patients with serious mental illnesses are not dangerous. Many people believe that. So these patients are no more dangerous or violent as compared to the general population. In fact, they're more likely to be victims rather than perpetrators. Lastly, the most common misconception is that only those who are crazy go to a mental health professional. But that's not true. Mental health is not just the absence of the illness, but it's our ability to deal with life stressors and lead a productive life. So a person who is mentally healthy can also have emotional problems, and there's no harm in asking for help. So always remember that there is no health without mental health.